In October 2021, the Canadian Drug Policy Coalition, in partnership with the John Howard Society, Indigenous Harm Reduction Network, and the Gilbert Centre, conducted a 2-day community dialogue. The discussion focused on the effects of drug criminalization policies on health, human rights, the toxic drug supply, and the ongoing drug poisoning crisis. The report was published in April this year, outlining 5 key recommendations. These are the creation of a municipal task force, exploring a potential request for the decriminalization of illicit drugs, enhancing immediate access to deeply affordable housing, offering harm reduction training for municipal staff and municipally funded social service agencies, and establishing collaborative multi-sectoral decision-making bodies that involve individuals with first-hand experience of substance use. We hosted a panel discussion involving representatives from the Canadian Drug Policy Coalition and the Gilbert Centre to delve deeper into the toxic drug crisis and the report's recommendations. This video marks the first installment in a 2-part series of the panel discussion. Yeah, so welcome everyone, and why don't we start with Sarah, if you can just introduce yourself.
Yeah, my name is Sarah Tilley. I am the Harm Reduction Program Manager here at the Gilbert Centre, and we worked in collaboration with CDPC and John Howard Simcoe Muskoka to put together the Getting to Tomorrow event and report.
Denise?
Hi, my name is Denise Baldwin. Currently, I'm working part-time at the CDPC as a community engagement and education coordinator. What else? When I began participating in the Getting to Tomorrow dialogues, I was in a position of the lead administrator, co-founder for the Indigenous Harm Reduction Network, and that's how I became involved in this project.
And anyway, you know Ernestine Baldwin?
That's my mom,
Oh,
yeah.
that's your mother?
Yeah.
Oh, wow. I talked to her a number of times.
Oh, okay.
And also did a podcast with BNFC.
Oh, right on.
Yeah,
Good stuff. Yeah. Yeah.
And Beeta?
Yes, my name is Beeta. I work at the Canadian Drug Policy Coalition with Denise and other of our great colleagues. And we had the chance to produce our Dialogues project. So I am one of the National Dialogues coordinators.
Beeta, if you can talk a little bit about Getting to Tomorrow report. I think that it's titled Decriminalization, Humanizing Our Communities.
For sure. So that report was the outcome of a dialogue that took place in October of 2021. And that brought together community members to talk about the impacts of criminalization and prohibition of drugs and the impacts to them and their communities. And so there was a number of small group discussions, some presentations. Denise was one of our MCs, and that was amazing. And that report documented some of the concerns that surfaced. And so there are a couple of recommendations that came up. One of the main ones was a recommendation for decriminalization of drugs, so the removal of criminal penalties for possessing drugs. There was also a call to minimize police interaction with people who use drugs. There was a call for support and an increase of harm reduction services. Many people talked about stigma in healthcare, as well as the housing crisis and the need to offer affordable housing for people. Another really key point was that people who use drugs need to be centered as leaders in this work and to be appropriately compensated for their labor and their expertise, and that there's a need for long-standing permanent services rather than pilot projects. So those are some of the themes that came up.
And who were the people involved in this, other than you guys? Who else was involved from the perspective of people who use drugs or who had those lived experiences?
Definitely, and maybe Sarah can speak a little bit to this as well, but community members, leaders, people who use drugs in the community, folks doing frontline harm reduction in the community, I believe we had the mayor at the time too.
Yes.
Yeah, the mayor showed up, which was great.
And what were the inputs? We are going to go into those specific points, but in general, what was their reaction to just being involved? And Mayor, I think Jeff Lehman was there at the time, showing up. So because it's been a 1.5 years, so did that get their hopes high?
In terms of the community?
Yeah.
I think that there's a lot of community, like service providers and people from agencies in the community who have been really excited about the report coming out, because it provides a local lens to some of the issues that they're seeing on a regular basis and issues that they're trying to address. And specifically, it looks at like larger systemic issues rather than focusing on individual problems, which I don't think is something that we see a lot on a local level. So that's been fantastic. In terms of the people that are using drugs who are most impacted by the policies that are at the forefront of this work, I think that it has been impactful in that it was an opportunity for people to come together and speak their truth in a setting where they were listened to. I'm not sure if the use of the report has been the same. There has been, and I think I can't remember who I was speaking to recently about this, but there have been quite a few deaths actually of participants who were part of the Getting to Tomorrow within the last 1.5 years. So it's been really sombering. But it's also provided, I think, something local in Barrie that engaged people who are using drugs in a lot of this work in a meaningful way that we've been able to continue here at the Gilbert Centre, and has been kind of a jumping off point to create different programming and to create different advisories so that people can continue to speak their truth and hopefully become more engaged in specifically that power sharing piece in terms of making decisions about things that are directly impacting them.
Yeah, because in the report I see a lot of quotes from specifically that that 2 days event, that when people spoke and what were their experiences. So one of the key aspect was decriminalizing drug use. So just starting with what do you think the benefits and specifically the barriers when it comes to decriminalizing drugs use in Barrie, and specifically based on the experiences and the stories that you heard? So if you can kick off.
Yeah, so I mean, that's a really big question. I don't think that Barrie, like some communities are already starting to have conversations. There's a pilot project in BC that is starting to look at and decriminalizing personal possession up to a certain amount. For example, Toronto is having conversations about similar pilot projects. I don't think that is even on the radar of Barrie right now. We are currently trying to get people to understand what decriminalization is in a meaningful way, and trying to really connect with service providers and people who are currently making decisions around services and policies that impact people who are using drugs to understand why decriminalization is something that we should be paying more attention to. And as people who are trying to support people who are using drugs in the Barrie community, why this is a mantle that we need to pick up as well. Yeah, so I'm not sure that answers the question. I think there's some expertise on more of a national level and how that will hopefully impact Barrie, but we're at the very beginning stages of that conversation here in this community.
And Denise, in terms of what is your experience or ideas in terms of decriminalizing drugs?
Well, as I guess, like from an Indigenous perspective, I think it's a little bit of might be a little bit of a challenge to kind of bring that kind of conversation forward, just because there are so many other kind of issues and stuff that are happening within our communities. But personally, I feel that decriminalization is probably the best way forward. I think it's going to really help the community in a way where they're not surveilled as much. There's no, people getting charged, people, as an example, sitting on like the bail charges and all that kind of stuff. And then, just this reoccurring kind of carceral state type of stuff. So I don't know. I think personally that it's a good way forward, but as far as like Indigenous people, I mean, we really have to be consulted too on a national level around decriminalization, because it's going to look different in our communities depending on where you're located. Yeah. So.
Yeah, because one of the points in the report was it's a health issue. It's not a criminal justice issue, and that was one of the focus. And another focus was youth based, because a lot of youth, they get kicked out of
the
shelters, even if they found with alcohol or drugs.
Yeah.
So in terms of Beeta, in terms of stigma that comes with the drug issue, drug use, and then that prevents people from getting help, or really working or getting a job, or getting their position in the society.
Absolutely. Stigma is a big piece. The fact that drugs are illegal encourages people to use either in secret or without sharing, and that can increase the risks associated with drug use and isn't really in line with the harm reduction approach. The current policies of prohibition are just not working. It's not working to discourage people from using drugs. People have still continued to use drugs over the past 100 years. It has not worked to make drugs less available. And in fact, it's actually worked to create a more potent drug supply. So because drugs are illegal, people are actually encouraged to develop drugs that are more potent so that they can be transported in smaller amounts. And you can see this, for example, in the US with cannabis. Cannabis is illegal in many states in the US. And recently we've seen the development of synthetic cannabinoids that are much stronger and that actually have really damaging side effects that we would never really see with cannabis as the herb. So you can see how when drugs are criminalized and prohibited, it can actually encourage the development of drugs that are more potent, that can be more dangerous than the original forms of some of these drugs. So here we can look at the difference between heroin and fentanyl, for example. A lot of the deaths and accidental overdoses that we're seeing are because of the unregulated supply. And so prohibition has really done nothing to address those harms. And in fact, when you look at who's actually being criminalized for their drug use, those harms aren't felt equally across society. Some people are surveilled more, some people are targeted more. And so we really have to consider all these aspects when you think of it as a policy decision.
Yeah, because I believe the people of color and LGBTQ community is far more adversely impacted by by this decision, and it feels like 1930s of United States, the prohibition era, and a lot of resources are going after stopping people from using it, or the production of the drug. And so one of the points Sarah made was the community and community involvement in terms of educating people about the benefits of decriminalization. So how do you see you said in Barrie we are not even having those discussions, and other communities at least they are moving ahead on that issue. And given the May 14th motion at the Barrie City Council, it seems that that's not likely to happen. The discussion, or at least the safe consumption side that was approved and still with the provincial government in terms of further approval. So what do you think needs to be done in terms of education and how to move the ball forward with the safe consumption side that has been approved?
Yeah, I mean, I think that we need to really consider what is being addressed right now in terms of, so you spoke about the motion without notice that was brought forward on May 17th, and there is a huge concern within community, I think on all sides, around people who are experiencing homelessness, people who are using drugs in the community, especially those who are most visible, which are often people who have no homes, and often those are people who have experienced great traumas, those are people who are oftentimes experiencing poverty, and that intersects with all of the things that you spoke to earlier, because access to resources is limited based on different social identities. But in terms of what we need to do forward, I think we need to really look at why the things are happening that people are concerned about, and take an inventory of how we got here, and then what we can do as a community realistically to move forward. I think often what gets lost in a lot of these conversations, especially at a local level, is that there are so many benefits to supporting people in terms of creating safety within their drug use, that extend much farther than just the ideas of enabling drug use or people using drugs and being higher or any of those kind of narratives. But there are fiscal benefits to having a CTS or a supervised consumption site, which include reduced medical needs in the community, reduced police interactions, and the financial resources that are needed to support people through the criminal legal system, regardless of what the outcome of that is. And also, we need to move away from criminalizing poverty, which is usually who is at the forefront or receives the brunt of these policies, because the reality is that it costs so much more to continue to criminalize poverty and the associations around drug use with that than it is to support people so that they are able to create lives that meet their goals and their needs. I think that regardless of whether or not people are using drugs, people who are experiencing homelessness and are the target audience of the May 17th motion, is that the people who are most impacted, like people use drugs in all walks of life, but the only people who are being impacted by a lot of these motions and a lot of these policies, or that are most likely to be impacted, are people who are experiencing extreme levels of poverty. And we can't police our way out of that. We need to come up with a different solution. We've been trying to police our way out of it, and policing is so expensive compared to housing people, compared to feeding people, compared to providing people with the medical supports that they need, including physical and mental health supports, and also prevention, right? Like whether or not people are using drugs, people use drugs all the time. They use cannabis, they use alcohol, they use prescription drugs, often that are the same sorts of drugs that people are trying to access on the street. They are the same drugs, and society is not collapsing because people are using those drugs. The things that we see as problematic, the things that I think are bothering people on all sides of the spectrum, are when people are experiencing extreme poverty and aren't accessing the supports that they need to create healthy lives, whether they're using drugs or not. And I think that those are the kinds of things that we need to be focusing on when we're looking at these temporary solutions like a CTS that really just provides people a space that isn't public so that they can use drugs the way that people that have homes are able to. And so that those I heard a quote recently about when people are experiencing houselessness, the worst days that they've ever had are in public view. That isn't who they are all the time, every day. And just other people are provided the dignity of privacy. And a CTS would provide some of that dignity so that people are able to do things less publicly, less on display. But that it's just one small piece of what we need to do in order to move forward with a lot of those issues.
Denise, in terms of, in general and Indigenous community, what kind of education is required, not only to the community, but from community to the government?
From community to the government?
Yeah, so what government can learn from the Indigenous community,
right,
in terms of, legalizing drugs or, having the safe consumption sites?
Well, it depends on, like, if it's on reserve, that's a totally different thing, because that's like federal kind of area. But I think a lot, like within our communities, though, we still struggle with stigma around drug use, and because some of our culture dictates that we have to be sober for a certain amount of days in order to practice certain ceremonies or cultural practices. So, and then on top of that, there's immense amount of feelings of grief and loss too, because the drug toxicity crisis is showing itself on reserve and people are dying. And depending on where your reserve is, the hospital might be an hour away. There might not be an ambulance station on your reserve, So there's a lot of kind of things to consider there. I think the conversation would really have to start with community members who use drugs, but that can be hard to do because of shame, guilt, and the stigma around it. But ideally, we would have those in community that use drugs and substances to kind of lead the way and advise, say, chief and council on what should be done, and then basically all the AFN or Chiefs of Ontario really should be kind of getting involved in this stuff, but I don't think that that's happening right now. But in a urban environment or in a city like Barrie, I think it would be really helpful to have a space for Indigenous people who use drugs to actually just come together and talk and see ways that we can support each other. But again, it's kind of hard to do because, a lot of people use in their homes. A lot of people don't want to, have their families find out, that they're using drugs. And again, it just goes along with all that stigma and the guilt and shame of doing that, when in fact it's you shouldn't have to feel any shame or guilt if you have a drink or if you use whatever. Some people use drugs just to have pleasure because it feels good.
And also due to residential school and colonization, the homelessness and other issues are more prevalent when it comes to Indigenous community.
Yeah.
So in one of the bigger aspect in the report is affordable housing.
Yeah.
And that seems to be one of the main root cause of the mental health crisis as well as drug crisis. So what actions you think needs to be done at the local level as well as at the federal and provincial level?
Well, I really think that there's all these kind of condos or whatever going up in Barrie in development, and I haven't heard so far if they're making any of the units affordable housing units. I really think that there needs to be a lot more emphasis on that because, for one, as Indigenous people, we shouldn't be homeless on our own lands, right? That just doesn't make any sense to me. And everybody has the right to housing, it's a human right. But it doesn't seem to be taken that seriously as a human right. And I just, a lot more money needs to be put into housing. Way back when Mike Harris, lifted the rent cap and then it skyrocketed. Why should housing be $3,000 a month for a 1-bedroom or a 2-bedroom? Nobody can afford that anymore. And so you're finding a lot of families having to live together, intergenerational families. For myself, I live with my parents, my son, before I had my uncle was living there before he passed away. And so it's kind of disheartening when you see all these kind of developments popping up in this really pretty city that you would never be able to afford to live in, So, there just needs to be more money put into that from the federal and provincial government. Stop doing this, back and forth, same with the county and the city. There's this back and forth. It's no, there shouldn't be that. You should just, we're telling you what we need, so do it. It's that simple, really. Yeah.
Yeah. So so Beeta, in terms of affordable housing, how we can ensure that people who use drugs specifically are living or just out of jail or prison have access to permanent housing. So because a lot of those people we see, and that came up a lot in Barrie, because Barrie is the center where they drop off, people who come out of the prison. So if we provide housing to them, this issue can be addressed. What needs to be done specifically to address those, given there is a lot of stigma involved?
Yeah, housing is an issue that all three levels of government needs to work towards to fund. And at the municipal level, so at the city level in Barrie, there should be a push for deeply affordable housing. So that could look like short-term solutions. There is a report by the Office of the Federal Housing Advocate, and it goes over very realistic solutions for housing at the local level. So it could be like shipping container homes or tiny homes, or maybe converting existing units into housing for people, just as a short-term solution until that long-term affordable housing is built. So all levels of government have to fund this and have a responsibility to meet the needs of their residents. And when you think about unhoused people, like Sarah was saying earlier, like a lot of people use drugs. It's just that a lot of people have the privilege of having a door to close and privacy to go in to use their drugs. So I think we have to accept that, people have always used drugs and will continue to use drugs, and that is their right. They have the right to their own bodies and to put whatever they like in their bodies and to know what they're putting in their bodies. So that's one piece. And then people who are unhoused and people who use drugs, they're actually dealing with dual crisis and lack of housing and poor housing policy, as well as this prohibitionist policy. So if we want to improve conditions for people who use drugs, if we want to think about decriminalization, we have to think about the people who are actually most impacted by the harms of the current policies and develop solutions that meet their needs. And in so many communities that we went to in these national dialogues, it wasn't even a question, but housing always came up, like affordable housing. You can't really talk about improving the lives of people who use drugs without also talking about housing.
You visited different communities across the country. So what were your experiences, and what do you see Barrie specifically lacking?
I think that different communities have different levels of readiness, and I think that that depends a lot on who's in the community, who's influential in the community. And so there are different, strategies that you might want to consider. So one thing that I've heard in Barrie is the faith community. What would it look like to engage the faith community and, really demonstrate how a harm reduction approach is actually what's kind and caring for people in the community. But the fact remains the same. In rural communities, in northern communities, from New Brunswick to, Nanaimo, people are dying from the toxic drug supply. People are navigating not having housing, and there's a real need for leadership at all levels of government. And I think it's a real pity to think that we have to wait for everyone to ideologically be on the same level, considering there's been so much propaganda that have made drugs out to be evil and horrible, when actually, we think we need to look at our own government and our own policies that have created, such division and lack, when, these basic needs need to be met, and we need to move past the ideology.
There's two topics, police reforms and stigma around healthcare, and those, go hand in hand, as the report mentions that, this is a health crisis and not a criminal justice crisis. So, Sarah, in terms of your experiences in the city of Barrie, so what role in terms of the police currently plays when it comes to dealing with homeless and dealing with the drug crisis?
Yeah, so I think that the police have always had a role in dealing with whatever folks in positions of power have deemed unacceptable. So right now, as we saw with the motion without notice, the visibility of homelessness and the visibility of poverty is something that makes a lot of people really uncomfortable. And so one of the main things Barrie has done to try and address this, especially with this new motion and the new council, seems to be kind of a move towards increased surveillance, increased criminalization, increased policing. And even if it's not necessarily policing from the perspective of the police proper, there are a recent outreach initiative that seems to be focused more on surveillance and policing where people are allowed to be or where people should be, more than, you know, supporting people in terms of providing additional resources to the community. The thing with part of the conversation that's being had right now around outreach needing to provide referrals to community resources. Right now, community resources don't have the financial support and other resources that they need to do the work. There's a lot of talk right now in the community about getting people housing workers, that sort of thing. But if there isn't a housing market to supply people, it doesn't matter how many housing workers we have. And that goes the same for a lot of services. So right now there's a heavy focus on providing, these people who will tell people where they're supposed to be or which agencies to go to. But the reality is those resources don't have the financial support that they need to do that work. Another example is the Salvation Army and the food program and the inability to continue to run that because through the pandemic, there was a massively increased need among community, both housed and unhoused, to access food supports outside of what their financial resources would allow. And so there was a really heavy burden on the Salvation Army to provide that food support. And instead of increasing the budget so that could, to a realistic amount so that food program could continue, that program has become unavailable. But there has been an increase in the amount of policing style resources that have been provided to the downtown community. And so there's a disconnect in terms of where we're putting our resources and how we think that that's going to help people. If we don't have food, if we don't have housing, if we don't have access to medical supplies, basic necessities, then it doesn't matter how many people are working in the community, we're not going to be able to provide something that just simply doesn't exist. And so I think we really need to, whether it's that we need more money, I'm not sure, but we definitely need to reprioritize where the money is. And that's based on how we think we're going to address this issue. If the goal is to just push people out of the city, then policing is potentially the way to go. But if we're actually looking at addressing the issues and supporting community in a meaningful way so that people aren't dying at the rates that they are, so that it's not costing our healthcare and our criminal legal system as much as it is, then we need to look at what we need to do to support people from having to access emergency supports or from not necessarily entering the criminal legal system. And that means putting money into the programming, not just putting money into referral services, because again, we can't refer anyone anywhere if those services just simply don't have the resources they need.